I'm Chris Ring. I'm Principal Social Worker in Children's Services, and together today we've got Lynn. Do you want to introduce yourself, Lynn?
Hi everybody, my name's Lynn Dolphin and I'm the Principal Social Worker for Adults.
Fantastic. What thought it would be a nice idea to do to kind of as a way of, I guess, marking World Social Work Day, is to have a conversation with Helen and Leah, who introduce themselves in a minute. The theme of the day this year is a phrase, Ubuntu, which means I am because we are, which is a concept and a philosophy really relating to the kind of interconnectedness of all people and their environment. So something that kind of resonates with social work around the world. And we just thought it'd be nice to talk to Lee and Helen about some of their reflections, kind of linked to that theme, but in terms of what's been going on in what's been a really kind of challenging year, and perhaps some thoughts about kind of the year ahead. But before we do that, do you want to just introduce yourself? Come to Helen first.
Yes, hi everybody. Really nice to be here at World Social Work Day. My name's Helen Ferguson and I'm Head of Children's Social Care.
Hello everybody, I'm Lee Alexander and I'm the Head of Adult Services.
Great, thank you both, and thanks for your time this morning. I'll kick off with a kind of an open question to you both. You said that theme is in relation to kind of the interconnectedness of people and their environment. And I just wonder, in a year that's been so challenging for everybody in the social work profession and in the wider kind of social care system, I wonder whether or not you could share some examples of where you've seen staff coming together and really working within the communities of County Durham. And perhaps if I could come to Helen first.
Yeah, thanks. I think it has been the most challenging of years. I think a year ago, none of us could have possibly imagined the scale of some of the challenges that we've all faced over this last year. And I think there are some fabulous examples of how everybody's come together to really rise to that challenge. We've seen groups of staff and managers from right across the children's social work system working really closely together to make sure that services for children and families continue. Really close collaboration between our children's social care staff, our health colleagues, our early help colleagues, education and school staff, public health colleagues, commissioning, who've really all found completely different ways of working in a really short space of time in order to think completely differently about the way in which we deliver services and support to children. And, you know, it's nothing short of remarkable, really. I think we've seen some lovely examples of how we've had to work differently with our schools, how we've shared examples and data with schools around being confident about whether our vulnerable children are there or not, encouraging our vulnerable children to attend school, but where they're not in school, being confident that we're either visiting them or schools are in touch with them. We've seen some lovely examples of how we've put support plans around our foster carers so that they continue to provide such high quality support to our children, and some really lovely examples of the sterling efforts that our staff in our children's homes have made to care for our children in really challenging sets of circumstances.
That's fantastic. Thanks, Helen. How about you, Lee?
Yeah, I would just follow on from that and really echo much of what Helen said there. I think this last year has effectively been the most challenging year that any of us have ever faced, both personally and professionally. And what I've seen actually has really brought social work to the forefront of various professions. So hopefully that's not just short-lived. Within my world, obviously, adult sort of social work has got a much higher profile now, particularly I think in respect of working with older people and other vulnerable adults in care environments, and have really seen people pull together and go the extra mile. As Helen said, work in extremely challenging, very challenging environment. We've had to almost relearn how we actually go about conducting our practice and keeping people safe. Despite all the challenges, all the data that I see gives me no reason to believe that we've done anything other than achieve comparable outcomes to those that we always do. We've had staff who have continued to have face-to-face contact, lots of examples of that. Some of the more obvious ones would be the likes of our AMPs, who've had to continue to work in extremely complex and sometimes, you know, risky situations, and to work with obviously people who are experiencing acute mental health episodes, as well as the work we've continued to do in terms of, you know, direct visiting the most sort of needy and some of our more risky residents who reside in 24-hour care. So it's been absolutely phenomenal effort.
Absolutely. Thanks, Lee. Lynn, did you want to come in with the question?
Yes, I mean, you both talked there about what's been achieved. Out of that, what have you both been most proud of? Helen?
Well, we've only got about 5 minutes, I think, so we might not have enough time. I was thinking about this such an important concept of pride, and I think I would start by saying that when I think back to a year ago, everything changed almost, you know, within the space of a matter of days, but actually nothing stopped. And I think that is nothing short of remarkable. And I think Lee's already made mention of the fact that, you know, our visiting frequencies to our children actually increased. All of our services carried on delivering support. We continued to go and do face-to-face work and visit families and children in their own homes when lots of other services weren't in a position to continue to do that. And the professionalism and dedication and the creativity and the humour and the determination to continue to deliver our essential services to some of our most vulnerable children and families, it is nothing, you can't help but be absolutely proud of that. I think there've been so many individual acts of kindness throughout the course of this last year. And some of those really kind of stand out and immediately spring to mind. You know, I can think of examples of social workers planting up little seedlings in pots to give out to children so that they had kind of something to look after. There were people crocheting little red hearts to give out to their young people so that young people felt that they weren't on their own and that they knew somebody was looking after them and looking out for them. There were so many examples within teams of how you as social workers and managers and frontline staff looked out for each other and looked after each other. You know, again, examples of people just doing fun things together, making music together, dancing together, making daft videos together, but also making sure that nobody was left isolated, nobody was left on their own, nobody was left feeling like they had to do it without the support of each other. And I think that is just tremendous, really. And then I suppose my other thought is that I have been so privileged to read so many examples of feedback from children and families that we've received over this last year about the services that they've the services and support they've experienced. And it goes back to that thing of, you know, nothing stopped, and in some instances things have actually improved for some of our children and families. Some of the letters that we've had, some of the cards that you all as social workers have received, you know, they make your heart sing, really, and they often have brought a tear to certainly my eye, and I know many of yours as well. So I think overall, my overall sense of pride would be in the way in which everybody's come together as a service and services right across the council, but also across the wider partnership, looked out for each other and made sure that nobody feels like they're on their own throughout what has been undoubtedly one of the most challenging years that many of us have ever lived through.
Yeah, just to build on that, again, completely echo what Helen said there. For me, I'm proud to be able to do what I do for a living. I'm proud of my social work roots. I'm proud of the workforce, and I think that pride really has increased significantly during this last year. All the things that I potentially thought I knew about the professionalism, the dedication, the commitment, the resilience, the strength of the workforce in County Durham, that's been magnified significantly in these last 12 years, last 12 months rather. It feels like 12 years, doesn't it? And it's not about me really, it's about the workforce. And I think just linked to the theme of World Social Work Day, you're only as strong as, you know, as the collection of your component parts. And it's how everybody has pulled together, gone the extra mile. the empathy, the understanding, the care and nature of our professions really have exemplified themselves during this last year, and that's absolutely amazing. I think, as Helen says, it's something that it does actually make you quite emotional at times. I think during this last 12 months, everybody will have had dips. Everybody's probably had personal issues to deal with as well as professional challenges. And what I've seen time and time again, when colleagues, whether that's been peers or colleagues at various levels in the organisation, have possibly been struggling more than any other time, I've seen other people come together, probably recognise that more than they would have done previously, and actually, you know, always kind of wrap arms around people to support them. And that collective effort, really, it's worth its weight in gold.
That's great.
And I think, Lee, this next question follows on nicely from that. So if we're to reflect on this past year, what will you take from that in terms of learning for the service?
Yeah, for me, clearly, and Helen mentioned it earlier on, we changed overnight. Not only did our practice change and how we actually, you know, went about our business, our culture changed. I think we managed to become much more effective at getting things done. We were less inhibited by some of the normal organisational rules or system rules that sometimes people feel are frustrating. I think from a leadership perspective, probably not just across the service, across the health and social care system and with other partners, there's been concerted efforts because of the pressure we've all been under to get things done in a much slicker way. And I think many of us will probably have an unhealthy or a healthy, sorry, intolerance for things creeping back that don't add any significant value. And for me, that's been one of the key elements for me that's kept everybody going. And it's really, really important that we get the best out of COVID, because despite, you know, the difficult year we've all had, personally, I think there's a load to be actually really positive about and celebrate on a professional practice basis, because we've actually achieved so much. And actually, some of our practices, I think, have actually improved and have changed for the better as a result of COVID. And we need to continue with those practices and build on them.
Definitely. Helen?
Yeah, I think we've learned a huge amount over the last 12 months, and there's lots of things that we want to continue to do, and there's some things that we don't want to do anymore, and there's lots of things that we have really missed. And I think that the challenge for us in the next 12 months is to work out which category we're going to put some of those things into that have happened over the last 12 months. I can't imagine a situation where we ever go back to exactly what life looked before COVID, really. I think all of us have missed the opportunity to be in offices and spend some face-to-face time with our friends and colleagues, and all of us will be looking forward to an opportunity to be able to do that again. But equally, I think there are lots of us who recognise that there's lots of benefits to some of the ways in which we've worked, and we've also had feedback from our children and young people and families that they've appreciated the opportunity and found some of what we do much more accessible whilst it's being done virtually than otherwise. So I think the trick is to learn from that, make sure that we go back and listen to our children, young people and families, so that we build the future based on their feedback and how they want services to be delivered for them in the future. Listen to you all as our workforce and our frontline staff, and make sure that we deliver and develop services that work for you all. Not lose what we've learned and build on a lot of the strengths of the last 12 months. And I guess my final thought for the year ahead is that we have built new connections and new relationships with each other and with other parts of the system that are stronger now than perhaps they were before. And again, that feels like a really fabulous foundation to build on, and we don't want to lose that either.
That's great. Thanks both for taking the time just to share those reflections. And I really hope that you know, those people watching this are able to access the activities that are available kind of online today, and just take a bit of time out to reflect yourselves on just the amazing work that you've done over this last year. And you know, we know it is challenging, and we know it's a challenging environment. It's not going to get easy, you know, very quickly. But you know, there's an awful lot of support there for everyone in both adult and children's services. You need to look out for each other. You know, we will continue to work as hard as we can to make sure that the support's there for you all. So it's just a real opportunity to thank you all for the work you continue to do. And thanks, Lee and Helen, for your time this morning. Okay.
Thank you.
Thanks.